Hello, good evening. Actually, it's good evening in the United Kingdom, and hello to everyone, anyone, wherever you are seeing this video. And to my subscribers, thank you so much. Thank you for tuning in again. Please remember to share, subs, and encourage family members, friends, colleagues to also subscribe and then share, like, and then give your comment. I do know it's early days for the channel, which is the Kosh TV on YouTube, but we are going strong, and I believe all informations I'm giving you are helping so much. One more thing, please to give credit to the channel if you do get some informations beneficial and you use them. It's just it's nice, don't we think? Yeah, please do try and then give credit to the channel, okay? And I'm Janet. This channel, yes, we do have other experts who back this channel. Today, I did promise on talking on the topic overweight, obesity leading to pre-diabetes, a brief history about pre-diabetes. Did I say history? A brief overview about pre-diabetes. It's going to come on. I may be uploading both videos at the same time for you, but something has come up, and I think I need to mention this. It's really important. I would first of all like to pay tribute to our receptionists, our ward clerks, all those helping with various health professionals deal with documentations, sending out of letters, the receptionists at our various doctors' surgeries and all. My hat's off to you. Thank you so much for the hard work we do. Yes, as we pay tribute to them and thank them for the hard work, their efficiency, to you, the receptionist, and the non-clinical staff, non-clinical staff, those who deal with documentations and sending out of informations and letters. Let's make it a habit to update our experiences. Let's make it a habit to improve on our services. Take, for instance, someone comes to you saying that they've been sent over by a specialist, a doctor, or any other professional for a blood test. And the person tells you, oh yes, they have been told. And probably the person may have forgotten the letter. To the best of my knowledge, what I do understand is with the electronic system that is being run by the NHS, informations are readily sent, especially if it's coming from a specialist. And if it's going to be available to the surgery or the doctors, the specialist will tell you, okay? So when someone comes to you, please take the trouble to check your system, all right? Check your system, book the person's appointment. Obviously, if the person comes for the blood test and hasn't got the letter that you think you need before the procedure is done, you send the person away. You just imagine somebody who is quite poorly and probably can't go to the main a healthcare center, hospital, or healthcare facility and comes to you at the doctor's surgery knowing that, oh, they will be well received, and then they are sent back home to go and get a letter before an appointment can be made. I've worked on the wards in the NHS, I think give and take a little less than 13 years or so in the NHS. And what I understand, and with my services that I've received from various GP surgeries, doctor surgeries in the past, is that it's they check and then they book you on. Yes, it is the responsibility of whoever is coming to you to bring the letter, to have the appointment done. But with this electronic age, things are done within minutes, things are done within days. So with the let's be kind. What I'm trying to say is that let's be kind to our clients, let's be kind to our patients. This channel is purposely for sharing information among healthcare providers, healthcare professionals, and educating the public, okay, as to what to expect. But it's also aims at encouraging us all to improve our services as a healthcare professional, and it also aims at encouraging the community of their responsibility. So it's reminding them of their responsibilities, as it also encourages us to improve on our services. It's not, and I would like to mention that it's not going to be based on private life. Honestly, I'm quite a private person, and I wouldn't be talking about my private life on this channel. I would only share what I feel comfortable with, and what some experiences, okay. And yes, what I post is mainly based on my experiences as a professional, my interaction with the community, my clients, my patients, my interaction with other members of the multidisciplinary team. So let's try and not to kind of force anyone's hand to actually talk about things that they don't really feel comfortable about. Yes, if a service has been rendered and I think there is an improvement to be done, I will talk about it. And if I feel someone needs to be praised, I will talk about it. Okay, let's try. No one is saying the job is any easy. No, it's not. Resources are quite restrained, and there's so much going on. But let's not let that make the people we deal with, our clients we deal with, feel like a burden, feel as if they have to actually beg for a service which is due them. Okay, I'm just taking this opportunity to put it out there. Let's try and be kind to our clients. Talking about this, yes, we talk about diabetes. Government has allocated funds. I mean, it's part of the NHS services to give treatments to diabetics. Diabetics are saying they have planned treatment and services. They are entitled to certain services. If you look at things, especially if you look at this musculoskeletal issues like this, global is a global thing. I think from my research, if I'm not lying on top of my head, I think is the Mayo Clinic. It says that 25 to 35% of adults below the age of 60 suffer chronic back pain, okay, which is due to lifestyle, sometimes work issues. Yes, we all understand that some do go away, some you have to receive some form of treatment. But there are other musculoskeletal issues which can be quite debilitating, that trying to earn an income can be really, really difficult. They actually make life very difficult to live, let alone you trying to get back to your normal duty. Let's say if you were a nurse, if you were a doctor, whoever you are in the health care profession, it can be quite difficult. When I was in the NHS, you go through all sort of interviews, sake of interviews and all that, to actually make sure that you are actually sticking to your programs, you are actually dealing with concerns as they are, especially if you seem to be taking days off from work. However, what happens to the nurse, the doctor who isn't in the NHS, or any other health care professional who isn't in the NHS? Are they treated less? How, if we're talking of prioritizing these professionals, because we expect them to go back to work and render services, what about the non-NHS healthcare professional? What skill, where do they fit in on that level? How long do they have to wait to see a specialist? I've come to realize that this can be quite difficult. I don't know if it is the norm, but someone waiting for nearly about a year to actually see a specialist, that is a bit unfair. We need to do more. We need to do more to make sure that people who are willing to get back to work, despite their conditions, or because sometimes these musculoskeletal issues can be seen as a disability, are seen so that they can get back to work. It can be a bit disappointing when you seem to be of a less priority to your healthcare provider. No one really wants to be a burden. You don't get educated, you don't get to learn skills and decide not to use them. So this goes to the authorities out there. Let's make some of these health professionals also a priority. Let's not pay the attention to only the NHS worker or the diabetic who is a diabetic and is entitled to some services, services treatment under the NHS. And for that matter, they are seen more as a priority. Does that mean that I don't want to sound obnoxious or kind of insulting? But not everyone wants to be a diabetic. Not everyone wants to be a diabetic. We all want to live a healthy life, a normal life, a happy life, and give our due to the community. Thank you for listening to me. Remember to share, subscribe, and like. Leave your comments. And as I always say, you and your community are responsible for your well-being. So make it a point to be a positive impact or influence wherever you are. Thank you. See you again soon. Bye-bye.